Welcome! This video provides a tutorial on fee-for-service claim submission for the Medicare Diabetes Prevention Program, or MDPP, using the PCA software, which is free to access. This video includes the following sections. 1. Introduction to MDPP and billing for MDPP services. 2. What is the PCA software? 3. Setting up reference files in PCAs. 4. Creating claims. 5. Claims review and transmission. 6. Common claim issues and points of confusion. 7. Processes after claim submission. And 8. Additional resources. Before we go any further, it is important to understand a few key terms that will come up throughout this video. Claim submission for Medicare Diabetes Prevention Program, or MDPP, is the focus of this video. PCAce is a free electronic software system for managing and submitting healthcare claims. Medicare Administrative Contractors, or MACs, are private healthcare insurers that have been awarded a geographic jurisdiction to process Medicare fee-for-service claims. Fee-for-service, or FFS, is the traditional, also known as original, Medicare plan, where healthcare providers are paid a separate fee for each individual service they perform for a Medicare beneficiary. The Provider Enrollment Chain and Ownership System, or PACOS, is an electronic system that supports Medicare's supplier enrollment process and which allows registered users to manage their Medicare enrollment information. A Medicare beneficiary is a person entitled to Medicare benefits. An administrative location is a physical location associated with an organization's operations, where the supplier is the primary operator of the space. Supplier operations include MDPP services and any administrative functions for MDPP. For example, where claims billing is conducted. MDPP is a group-based behavior change intervention that aims to prevent the onset of type 2 diabetes among Medicare beneficiaries who are diagnosed with prediabetes. The program encourages beneficiaries to make lifestyle changes related to diet and exercise, with the primary goal of helping Medicare beneficiaries achieve at least 5% weight loss. MDPP is delivered by enrolled suppliers. These suppliers must have recognition from the Centers for Disease Control and Prevention, CDC, Diabetes Prevention Recognition Program, DPRP, which confirms adherence to the latest CDC DPRP standards. The CDC updates the DPRP standards every 3 years, with the most recent update prior to this video taking effect on June 1, 2024. Suppliers maintain a roster of MDPP coaches, recruit eligible Medicare beneficiaries, manage beneficiaries through the 22 total sessions allowed during the MDPP service period, and submit claims for services provided. Suppliers can choose to deliver MDPP sessions in person, via distance learning, or as a combination of both modalities. MDPP coaches must be trained per a CDC standard and must furnish the program using a CDC-approved curriculum. The MDPP service period occurs over a total of 12 months and is split into 2 parts. The core period covers months 1 to 6. During the core period, suppliers offer up to 16 sessions, no more than 1 session per week. Following the core period is the core maintenance period in months 7 to 12. During the core maintenance period, suppliers offer up to 6 sessions, no more than 1 session per month. The 12-month MDPP service period starts on the day a beneficiary attends their first session. Medicare pays MDPP suppliers for furnishing MDPP services to eligible beneficiaries using a fee-for-service structure, which includes performance payments. MDPP suppliers can claim 2 service types: beneficiary attendance at an MDPP session and beneficiary weight loss achievement. Please be aware that MDPP HCPCS codes may be updated through future rulemaking. Additionally, payment rates associated with these codes are subject to periodic adjustments to account for inflation. We recommend regularly checking for any updates to guidance available on the MDPP website for the current MDPP HCPCS codes and corresponding payment rates. As of the calendar year 2025 physician fee schedule, there are 5 MDPP HCPCS G codes split across these 2 service types. Codes G9886 and G9887 are used for beneficiary attendance, with G9886 corresponding to the beneficiary attending in person and G9887 for the beneficiary attending via distance learning. Codes G9880, G9881, and G9888 all correspond to different types of weight loss achievement. G9880 should be claimed in conjunction with session attendance when a beneficiary first achieves 5% weight loss from their baseline weight. G9881 is similar to G9880, but is used when a beneficiary first achieves 9% weight loss from their baseline weight. G9880 and G9881 should each only be claimed once per beneficiary. G9888 is for beneficiary maintenance of the 5% weight loss during a core maintenance session. There are 6 possible core maintenance sessions that can be claimed in months 7 through 12 of a beneficiary's service period, meaning that G9888 could be claimed a maximum of 6 times for a beneficiary. Before submitting MDPP claims, there are a few important steps that must be completed. 1. Your organization must be enrolled as an MDPP supplier. As part of this process, your organization should have provided information on the coaches who will deliver MDPP services for your organization, completed an electronic funds transfer or EFT authorization form, and completed your MAC's electronic data interchange or EDI enrollment procedure to receive a submitter number for use during claim submission. 2. Your organization should have verified that beneficiaries are eligible for MDPP. 3. Your organization must have begun delivering MDPP services to eligible Medicare beneficiaries. 4. Your organization must have gathered required information on each beneficiary receiving MDPP services and on the sessions they've attended. If these steps have not been completed, you are likely missing information critical to completing an MDPP claim and may encounter denials or rejections when submitting claims. For more information on enrollment and related MDPP activities, you can find helpful resources such as the eligibility fact sheet on the MDPP website. Links to helpful resources can also be found in the video description. For the remainder of this video, we assume that these steps have been completed. To get started with billing and receiving payment for delivering MDPP services, there are a few key items to complete to ensure your claim submissions are successful. 1. Identify your Medicare Administrative Contractors, or MACs. It's likely you already know your MAC from completing the MDPP supplier enrollment process, but if not, there are resources available to help you identify them. Please note that if you have administrative locations in multiple states, you may need to work with multiple MACs. 2. Understand the billing or payment structure for fee-for-service claim submissions. 3. Understand where to submit your claims, including what software or third-party billing agent you will be using to process claims and to which MAC portal those claims will be transmitted. Finally, 4. Understand how you will receive payment and what to do if your claim is rejected or denied by your MACs. What is PCACE? PCACE is a software program that allows users to electronically submit claims to the MACs for Medicare services. PCACE users will enter claims data, including relevant organization and beneficiary information, as well as billing details on the services rendered. Each MAC has their own version of PCACE that corresponds to their claims system, and these software differ slightly. Some of these PCACE versions will allow you to connect and directly submit claims to the MAC's portal, but not all. Please contact your MAC for further details or assistance if you encounter issues with accessing and installing the PCA software or have questions about connectivity. Images of the PCA software used in this video come from the Novitas 6.6 version. Despite the specific version being shown, the information in this tutorial is broadly applicable regardless of the MAC with which you will work. Besides electronically self-submitting claims using the free PCA software, your organization may utilize another purchased claim software. Your organization may utilize a vendor or third-party billing agent to submit MDPP claims. Any vendor or third-party billing agent must be listed on your MDPP enrollment application. Your organization may also file claim submissions using the CMS 1500 paper claims form. Please note you must first obtain an exception to file paper claims by accessing the ASCA waiver page on the official CMS site. Lastly, certain MACs offer claim entry through a web-based portal. This option is only available for suppliers submitting a small volume of claims, 10 claims or fewer per month. Before we dive into using the PCA software to submit claims for MDPP, we want to highlight some functions and shortcuts of the software that may prove helpful. First, whenever you're populating a field, you can always hover your cursor over it to see a description of the expected content. Second, you can hit the F2 key or alternatively right-click on your mouse to bring up potential shortcuts for populating a field. This may take two forms. If there is a reference file that would include the information the field is expecting, then hitting the F2 key or right-clicking should bring up this file. We will get into more detail on reference files in the next section. If there is a limited set of predefined values the field will accept, then hitting the F2 key or right-clicking will bring up a drop-down list of the potential values. If there is no reference file that can be called upon and no set of predefined values for a field, then hitting the F2 key or right-clicking won't do anything. Third, whenever you're saving a form, whether a reference file or a claim, you may encounter an Edit Validation Errors list. If so, the PCA software has identified at least one field as missing or incorrectly populated. If none of the identified issues has a red X, then you may proceed to close out the Edit Validation Errors list and hit the Save with Errors button. However, if possible, we recommend resolving errors when they are first identified. There are four key components to using the PCA software to submit MDPP claims. First, suppliers populate reference files. Second, suppliers populate claims for MDPP services furnished to eligible beneficiaries. Third, suppliers review those populated claims for any errors. Fourth and finally, suppliers prepare those populated and reviewed claims for transmission to the appropriate MAC. The reference files allow suppliers to store information that will be referenced repeatedly when submitting MDPP claims. By taking the time to populate and maintain the reference files, you are able to more quickly prepare your claims and avoid errors that can occur when repeatedly entering information manually. Once your reference files are prepared, you're ready to populate a claim. Suppliers will move through the claim form using information contained within the reference files to auto-populate many fields, while manually updating fields that are unique to every claim submission. For example, when populating a new claim, suppliers pull information from the patient reference file that is not expected to change during a beneficiary's service period, such as the beneficiary's name, Medicare Beneficiary Identifier, or MBI, and birth date. This information auto-populates the relevant fields in the claim form. Fields that are specific to the claim instance, such as the dates of service for each session the beneficiary attended, are populated manually by the supplier. After populating claims, suppliers should review them to ensure all required fields are populated and correct any potential errors before proceeding with transmitting those claims to the appropriate MAC. Once claims are populated and reviewed, suppliers will prepare those claims for electronic transmission to the appropriate MAC's portal by creating a claim file. There are 7 reference files that should be populated before moving to claims: HCPCS, Charges Master, Submitter, Facility, Group Practice, Individual and Group Practice, and Participant. As you move through populating each reference file, you will be able to utilize select information from some files to help you populate others. Reference files can be accessed by clicking on the Reference File Maintenance icon within the main toolbar of the PCA software. After clicking the Reference File Maintenance icon, you will be taken to a new window with a set of tabs corresponding to different reference file types. For submitting MDPP claims, the relevant tabs are the Patient, Provider, Prof stands for Professional, and Code/MISC tabs. The HCPCS codes for MDPP should be preloaded in the PCA software. However, the HCPCS codes for MDPP have changed significantly in recent years, so this tutorial will cover how to view and, if necessary, update the HCPCS reference. To navigate to this file, click on the Code/MISC tab within the Reference File Maintenance window. Then click on the HCPCS button under the Shared column. This will open the HCPCS reference file window. This file contains all the HCPCS codes preset in the software for use in billing Medicare for Part A and D services. Suppliers can filter to MDPP-related G codes by using any of the list filter options. Currently, we filter to code G9886 for in-person attendance. For the CY 2025 Physician Fee Schedule, there are 5 HCPCS codes for MDPP applicable to dates of service from January 1, 2025 onwards. 2 codes capture different ways MDPP beneficiaries may attend an MDPP session, G9886 and G9887. The other 3 codes capture weight loss achievements that would result in a performance payment, G9880, G9881, and G9888. As a reminder, payment rates are expected to change over time. The latest payment rate information can always be found on the MDPP website. Before proceeding, you should confirm that your PCA software contains all 5 HCPCS codes that may be used for MDPP. If you find a code to be missing, you will need to add the code by clicking the New button. After clicking the New button, a CPT/HCPCS code information window will open. In this window, you should enter the HCPCS code, description, and the effective start date for the code, and then click the OK button. For example, if you need to add code G9888, you would enter G9888 in the code box, then 5% weight loss maintenance from baseline weight in the description box, and a start date of January 1st, 2024 in the first effective date range box, since this code became effective on that date. You may leave the second effective date range boxes blank. Once we've ensured that all the MDPP HCPCS codes are captured in the HCPCS reference file, we can move on to the Charges Master reference file. To navigate to this file, enter the Code/MISC tab again within the reference file maintenance window, then click on the Charges Master button under the Professional column. This will open the Charges Master reference file window. This file allows you to associate a charge amount with a HCPCS code. The reference file shown here has MDPP HCPCS codes and their charge amounts already populated for CY 2025, but you may need to add codes. Please note, it is not possible to set multiple possible charge amounts for the same code. When the chargeable amount for a code changes between calendar years, it is recommended that you submit all your claims for the prior year and then update the Charges Master reference file to reflect the new charge amount for the new year before proceeding with populating claims for that new year. After clicking the New button, a Charges Master information window will open. In this window, you will need to populate the LOB, that's the line of business, the code description, and the charge amount. As you have already updated the HCPCS reference file, you can call upon that information to auto-populate many of these fields by right-clicking within one of the boxes or hitting the F2 key. Doing so here will call up the HCPCS reference file from which you can search for the code you want to add and then hit Select. You then just need to update the LOB box to be MCB, that's Medicare Part B, and add the appropriate charge amount for that code. The Payer ID box can be left blank. Once the necessary boxes have been populated, you can click the OK button to add this code to the Charges Master reference file. To ensure that the Charges Master reference file can be accessed when populating a claim form, you will need to update one preference in your PCA software. To do so, return to the PCA's main toolbar and click the File option, then select Preferences. This will open the Preferences window. Make sure the box next to Use Charges Master reference file for professional procedure code lookups is checked. If you don't take this step, information from the Charges Master reference file will not auto-populate when entering billing line information on the claim form. After populating reference files related to MDPP HCPCS codes, you will need to populate reference files related to your organization. The first of these is the Submitter reference file, which can be found under the Code/MISC tab of the Reference File Maintenance window, and accessed by clicking the Submitter button under the Shared column. After clicking the Submitter button, the Submitter reference file window will open. Within this window, you should select the Professional button at the top. Next, you will click on the New button. Your organization must enter information on 3 tabs within the Submitter reference file. First is the General tab. Here, your organization may need to populate up to 12 fields. the line of business or LOB, the payer ID, organization name, address, city, state, zip, phone number, fax, country, contact, and email. A drop-down list of options for populating the LOB and payer ID fields can be seen by using right-click or the F2 key. The number for the submitter ID field has been provided to you in your organization's Electronic Data Interchange or EDI welcome letter. Some but not all MACs ask that you populate the Employer Identification Number or EIN as well. We recommend checking with your MAC and their specific PCA's user guide documentation regarding this field. Moving to the second tab, Prepare. Required fields here should already be populated, but you should check that the submission status field is set to P for production. If the field is set to T for test, you should contact your MAC regarding any requirements to submit test claims before production claims are accepted. Please note that test claims are not paid. Moving to the third tab, ANSI Info. ANSI is the American National Standards Institute. The submitter interchange ID qual and receiver interchange ID qual fields should be set as ZZ, and the acknowledgement requested should be set as 1. Once you've populated and reviewed the General, Prepare, and ANSI Info tabs, you should click the Save button. If there are no issues with the information entered, the window will close and the entry will appear back in the submitter reference file. However, if there is an issue with the submitted information, then an Edit Validation Errors list window will appear. The Edit Validation Errors list window will show any fields that should be addressed before submitter information is saved. As an example here, we haven't populated the state field on the General tab, so the software has flagged that submitter state was not populated. Next, you'll move to the Facility Reference File. This reference file can be found under the Code/MISC tab of the Reference File Maintenance window and accessed by clicking the Facility button under the Shared column. After clicking the Facility button, the Facility Setup window will open. This is where you'll save information on the various locations where your organization furnishes MDPP services. You will need to complete a facility entry for each location. Please note, for MDPP sessions that are delivered entirely via distance learning, the facility will be the location from where the coach is delivering the service. In order to create a new facility entry, click on the New button. This will open the Facility Information window. Here, you must populate the facility name and address fields, including the city, state, and zip. Additionally, please enter the facility type as 77 to indicate that the facility is a service location. When this is completed, click on the Save button. Next, you'll populate the group practice and individual and group practice reference files. These files will be created in the same location. Specifically, you should navigate to the Provider Prof tab within the Reference File Maintenance window. In the group practice entries, you will provide more information on your organization. You may need to create multiple group practice entries, particularly if your organization has multiple billing NPIs for MDPP or if you are submitting claims in multiple states. In each individual and group practice entry, you will provide information on a specific coach rostered with your organization. It is highly recommended that you create all your group practice entries first, as you can then reference these entries when creating individual and group practice entries. To start an entry, click the New button. This will open a Professional Provider Information window. Make sure you have the appropriate provider type selected at the top and that you are on the General tab. First, you want to create group practice entries, so that is what is initially selected here. You will then need to populate the following fields: provider group name, address, city, state, zip, phone, contact, group ID, LOB, payer ID, group label, NPI, tax ID, tax type, specialty, accept assignment, participating, signature in, and date. To ensure you enter the correct group ID, please contact your MAC or reference their specific PCA's user guide and documentation. You can select available entries for the LOB, payer ID, specialty, and taxonomy fields by right-clicking or hitting the F2 button. The payer ID should align with the state for this entry. The NPI field should include the specific supplier NPI your organization has for MDPP. The accept assignment field must always be A for assign. The participating field must always be Y for yes. Click the Save button to save the entry. Your saved group practice entry will now appear as a row within the Provider Prof tab of the Reference File Maintenance window. To create multiple group practice entries, highlight an existing group practice entry that most closely aligns with a new entry you want to create, and click the New button again. This will open the Professional Provider Information window again, but with an option to auto-populate all information from the highlighted entry, with the exception of Payer ID. To complete auto-population, select the Inherit option and click the OK button. You can now make whatever specific updates are needed for the new entry, such as a different payer ID or NPI, and then save as another group practice entry. You will also click the New button to create an individual and group practice entry. Make sure you have the provider type selected as individual and group at the top of the window. As the individual and group refers to a coach, you will populate the following required fields with information as it relates to a specific coach: last and first name, address, city, state, zip, phone, contact, provider ID, LOB, payer ID, group label, NPI, tax ID, tax type, specialty, accept assignment, participating, signature indicator, and date. To ensure you enter the correct provider ID, please contact your MAC or reference their specific PCA's user guide and documentation. You can select available entries for the LOB, payer ID, group label, and specialty fields by right-clicking or hitting the F2 button. The NPI field should include the coach's individual NPI. The accept assignment field must be A for assign. The participating field must be Y for yes. The provider roles field should have auto-populated based on the initial individual in-group selection, but if not, they showed the billing field as N and the rendering field as Y. Click the Save button to save the entry. You should now continue to populate a new individual in-group practice entry for every coach who you expect will deliver MDPP sessions on behalf of your organization. Now that you've populated all the reference files related to information for your organization, you will populate reference files related to the MDPP beneficiaries your organization is serving. To begin this process, navigate to the Patient tab of the Reference File Maintenance window. You will start a patient reference file entry by clicking the New button. This will open a patient information window. Similar to the submitter reference file you completed earlier, you will need to enter information on multiple tabs within this window for each MDPP beneficiary. Starting with the General Information tab, you must populate the following fields: the beneficiary's last and first name, the patient control number or PCN, the beneficiary's address including city, state, and zip, the active patient designation, the beneficiary's sex, date of birth or DOB, and the release of info. The active patient designation field will default populate as Y. Please note, the patient control number is a unique alphanumeric number assigned by you, the supplier, to assist in identifying the beneficiary when receiving remittance advice or retrieving individual financial records. After the General Information tab, you next need to populate the Primary Insurer Prof tab. The following fields are required: payer ID, payer name, LOB, relationship, REL, the last and first name of the policyholder, insured ID number, assign of benefits, and release of info, or ROI. Please note that the payer ID, payer name, LOB, and relationship fields can be populated using right-click or the F2 button and should be based on the patient's residence. Once you've populated all the required fields, you can click the Save button to add the entry to the patient reference file. You will need to create an entry for every MDPP beneficiary for which you intend to submit claims. Now that the reference files are prepared, you are ready to move on to creating an MDPP claim. During this process, you will call upon the reference files you have created to quickly populate large sections of the claim form, while also manually populating select fields that can vary on every claim. Once we've covered the basics on how to populate the claim form, we'll demonstrate elements of an example claim for MDPP. To access the Professional Claims window, click on the Professional Claims Processing icon within the PCA's toolbar. Click on the Enter Claim button within the Professional Claims menu window. After clicking on the Enter Claims button, a new window called the Professional Claim Form will open. Starting with the Patient Info and General tab, suppliers are required to populate the following fields: the LOB, which will be auto-populated, billing provider, patient control number, the beneficiary's last and first name, their birth date, their sex, their address, including city, state, and zip, whether the patient condition is related to employment or an accident, the release of info or ROI, whether they have other insurance, whether the claim will include outside labs/charges, the provider accepts assignment, provider signature on file or SOF, and the facility. Some MACs also require that the MDPP demonstration code, that is Demo Code 82, be placed within the Reserved for Local Use field. We highly encourage you to check with your MAC and their PCA's user guide and documentation regarding where the Demo Code 82 should be entered. To quickly populate most of these fields, we will call up information already entered in the reference files. To do so, right-click or hit the F2 button in the Billing Provider field. This will access the Group Provider reference file and allow you to select the appropriate provider entry. Once a provider is selected, fields related to the provider will be auto-populated. You will now do the same thing in the patient last name. Right-click or hit the F2 button to bring up the patient reference file and select the appropriate beneficiary entry to auto-populate their information. Some required fields will not be auto-populated. You will need to review these fields and manually populate them. As elsewhere, in many of these fields, you can right-click or hit the F2 button to see a drop-down list of the potential entry values. If you select Yes when populating the Facility field, you will also need to populate select facility information fields on the Extended Patient/General tab. You right-click or hit the F2 button to call up the facility reference file. You will then select the facility entry at which the services on this claim were delivered. You may need to manually populate the facility type field even after accessing the reference file. This field should be 77 for an MDPP claim. Moving to the Insured Information tab, you will need to populate the following fields: the payer ID, insured ID, patient's relationship, or PREL period, insured's last and first name, and assignment of benefits, or AOB. Moving to the Billing Line Items tab. On this tab, you will describe the MDPP sessions furnished to the beneficiary and potentially any performance payment claims for weight loss achievement. You should first populate at least one diagnosis code. Common diagnosis codes for MDPP are Z71.89, Z71.9, and R73.03. You must then enter the service dates for each session, or, if claiming a performance payment, the service date of the session when the beneficiary's weight loss achievement was recorded. You can enter multiple different sessions with different dates of service on the same claim form. You should then populate the place of service. For distance learning sessions, the POS should be 99. For other place of service, do not use the place of service codes for telehealth. For the HCPCS field, you should enter the appropriate G-code for the service. If you populated the Charges Master reference file earlier, the Charges and Units field will auto-populate based on your G-code entries. If you are claiming two sessions with the same date of service for the beneficiary, a makeup session and a regularly scheduled session, then for the makeup session you must also enter the current procedural terminology or CPT modifier 76 code in the first modifier field. In the diagnosis field, you will enter 1, which points to the first diagnosis code you entered as the primary one. For the rendering physician field, you must also enter the NPI of the coach who delivered the service. You can right-click or hit the F2 button to bring up your earlier entries to the individual and group provider reference file, and then select the appropriate coach to auto-populate this field. We want to note that this is a commonly missed field in MDPP claim submissions. Finally, you should hit the Recalculate button to update the total charge and balance due fields based on the charges provided. Click the Save button to save the populated claim form. Populating the MDPP demo code is a required component of claim submission. Suppliers should always enter the demo code on the Extended Payer/Insured tab, specifically by entering the 82 code in the Payer/Insured reference IDs field and then entering P4 in the types fields. It was noted earlier that some MACs request a demonstration code be populated in additional locations, such as the Reserved for Local Use field on the Patient Info and General tab, which we showcased. Another such location is the Special Program Indicator field located on the Extended Patient/General tab, where you may enter the 82 code. Again, we strongly recommend you check with your MAC or MACs their PCA's user guide and their claim documentation regarding where they expect the demo code to be entered. Now we will populate an example claim form using some fake supplier and beneficiary information. Jane Smith is a 67-year-old Medicare beneficiary who lives in remote Colorado and who has started an MDPP course with Great MDPP Supplier. Great MDPP Supplier is an MDPP supplier based in Anytown, Colorado, who primarily offers distance learning sessions. Jane has attended 4 sessions so far, including one makeup session that was held the same day as a regularly scheduled session. She also achieved 5% weight loss from her baseline weight during the last of these 4 sessions. Great MDPP Supplier must now complete a claim form for the sessions Jane has attended and the performance payment for Jane's 5% weight loss achievement. Starting with the Patient Info and General tab of the Professional Claim form, we're first going to call up supplier information entered into the Group Practice Reference file by hitting the F2 key or right-clicking in the Billing Provider field. Selecting from the Provider window the entry for Great MDPP Supplier, PCAce auto-populates information for the LOB, Billing Provider Number, Federal Tax ID, Social Security Number or Employer Identification Number designation, Provider Accepts Assignment, and Provider Signature on File, or SOF fields. We now do the same thing but for patient information, hitting the F2 key or right-clicking in any of the patient fields. In this case, we'll click in the patient last name field to bring up the patient reference file. We'll then select the entry for Jane Smith. PCAce then auto-populates Jane's information, adding the patient control number, last name, first name, birthday, sex, legal representative, address, including city, state, and zip, release of information confirmation, and other insurance fields. There are then a few fields remaining on this tab that we need to manually populate. First, we'll note whether Jane's condition, that is pre-diabetes, is related to her employment or an accident. In Jane's case, it is not, so we put N in both these fields. Second, we're going to note that there were no outside labs/charges associated with this claim by putting N in that field. This field should always be no for MDPP claims, as MDPP does not cover lab charges, and non-MDPP claims shouldn't be mingled with MDPP claims. Third, we're going to enter Y in the facility field to capture the facility from which the coach delivered distance learning sessions to Jane. Fourth and finally, we need to enter the MDPP demonstration code, which is 82, in the types fields on the Extended Payer/Insured tab. Your MAC or MACs may expect the demonstration code in additional locations, so please check their specific guidance. Because we have now acknowledged that these MDPP services were furnished from a facility, PCAce will prompt you to enter that facility's information. By hitting the F2 key or right-clicking in a field in the facility information section, such as name, we can bring up the facility reference file. From this, we can select the facility from which the coach for Jane's distance learning sessions delivered the classes. In this case, it's Great MDPP Supplier. This populates the name and address, including city, state, and zip fields. We then also need to manually populate the facility type field with code 77. Now that we've entered information for the Patient Info and General tab, we need to capture insurance information for Jane on the Insured Information tab. As before, we can use the entry for Jane in the patient reference file by hitting the F2 key or right-clicking in a field. PCAce will populate the payer ID, payer name, insured's ID number, patient relationship, insured's last and first name, birth date, sex, assigned of benefits or AOB, and address fields. Now that we have added general information about the supplier and the patient, the last tab we must complete is billing line items, specifically the line item details subtab. Here we'll describe the actual services that Jane received and for which the supplier is claiming payment. First, for a diagnosis code, we'll enter Z71.89, which stands for Other Specified Counseling. Second, we're going to enter the HCPCS G codes related to the services Jane has received. Jane has attended 4 distance learning sessions. We will enter G9887 on 4 lines. We will also enter a G9880 code for the 5% weight loss achievement that Jane met. As we enter these codes, PCAs will auto-populate the charges and units fields for each code based on the Charges Master reference file. Third, we need to enter the date of service for each session in the service dates fields. Fourth, we will enter the place of service code, which is 99, corresponding to other place of service. Fifth, because Jane attended a makeup session on the same day as a regular session, we need to enter a CPT code 76 into the modifier 1 field. The addition of the modifier allows the MACs to distinguish the second session on February 4th as a makeup session and not a duplicate entry. Sixth, in the diagnosis field, we will enter 1. This maps each line item back to the corresponding diagnosis code. Seventh, we will enter the rendering NPI. By using right-click or hitting the F2 button, we can bring up the individual in group provider reference file and then select the appropriate coach to auto-populate this field. Last, we click the Recalculate button to update the total charge and balance due fields based on the charges entered above. Now that we have populated all 3 required tabs, that is, patient info in general, insured information, and billing line items, we can click the Save button to save the populated claim form. Once a claim has been populated and saved, it will appear in the claim list. Once you've finished creating claims, the last steps are to review and prepare them before transmitting to your MAC. To review claims, you will again access the Professional Claims menu and then click the List Claims button. This will open the professional claim list showing you all the claims you've saved but have not prepared for transmission. The list will include a status column on the left side. Both claims with a status of CLN or clean and ERR or non-fatal errors can be selected for preparation, but we recommend resolving any claim errors before proceeding. Claims with a status of ERF or fatal errors must be resolved before proceeding. To review a claim, select it and hit the View/Update button at the bottom left of the window to re-enter the Professional Claim Form window for that claim. If you are unsure of the error in a claim, you may attempt to save. This should open the Edit Validation Errors list window, which will display any errors the PCA software still detects, and which you can use to navigate to the corresponding field. Once all the claims you wish to prepare have a clean status, you should return to the Professional Claims menu and then click the Prepare Claims button. This will open the Professional Claim Prepare for Transmission window. Within this window, you can use filters to select just a subset of the claims you've entered. You can also change between submitting your claims as production or test claims. Some MACs require that new users to their system submit test claims before submitting production claims. Please note that only production claims are paid. A confirmation window will open. You should click the OK button to proceed. If you prepared claims that had a non-fatal error status, these claims will open in the Professional Claim Form window and you will be asked to correct the issues detected by PCAs. Once all the prepared claims are clean, the Claim Prepare operation should be complete, and the Claim Prepare for Transmission window will open with a summary of the prepared claims, including how many claims there are and the dollar value associated with them. You can click the View Results in the bottom left side of the window to open a printable transmission detail report to view summary information on the claims you have just prepared. A transmission file with a DAT file type should now be saved in the local PCAs folder on your machine. The exact naming convention of the file will depend on your Mac and the specific version of the PCA software you are using. You can use this file to transmit your claims to your Mac. Once claims have been entered and prepared for transmission, the next step is to connect to your Mac. Every Mac will vary in the specific tool or portal needed to connect to their system. Here we are going to quickly provide the steps for connection to Novitas Solutions, the Mac for jurisdictions H&L as an example. You can connect to Novitas using one of two methods. You will need either a network service vendor that provides an SFTP or secure file transfer protocol connection, or you will use the Novitas Sphere portal to connect via internet. If using an SFTP, you will first connect to the EDI platform known as TIBCO using your network service vendor. Then you will locate the transmission file with the DAT file type you created earlier. It should be saved in the local PCAs folder on your machine. The default location is C:/WINPCACE. Next, you will click the file name and move the file to Novitas. If using the Novitas Sphere portal, you will first log in. Then you will navigate to the Claim Submission/ERA feature. Next, you click on the Claim Submission/ERA link, and then you click on the Inbox tab in the upper navigation bar. After that, you select the New button and then you select Interchange within the operations tree list. Next, you click Browse and navigate to the transmission file with the DAT file type you created earlier. Then you select the file and click Open. Last, you select the Upload button. You should reach out to your Mac if you have any questions or encounter issues regarding transmission. In some cases, you may need to amend submitted claims in response to guidance from your Macs following a claims rejection or denial. To quickly find claims that were previously sent to your Macs, you should return to the Professional Claim List window. Towards the bottom of the window, you will see a location filter, and by using the drop-down menu, you can select the TR Transmitted Only option, which will bring up a list of all the claims you have transmitted previously. From the list of transmitted claims, check the box next to those claims you wish to amend. Once you have checked all intended claims, click the Actions menu at the top of the window, and from the list that appears, click the Reactivate All Checked Claims option. If you set your location filter back to CL to be transmitted, you will now see the claims you just reactivated with the status of UNP or unprocessed. You can now reopen these claims and adjust them just as you would any other claim you had started, but not yet prepared for transmission. In this section, we are going to discuss some select MDPP claim requirements and common issues that have been seen in denied or rejected MDPP claims. First, make sure to always include the demo code 82. Failure to include the demo code is one of the top reasons MDPP claims are rejected or denied by the MACs. When submitting a claim, suppliers must include a Rendering Provider National Provider Identifier, or Rendering NPI, and a Billing Provider NPI. The Rendering Provider or Coach NPI corresponds to the NPI of the MDPP coach. As a reminder, all MDPP coaches providing MDPP services must have a valid NPI. It is required that coaches be added to your organization's MDPP supplier PACOS application, that is, to the coach roster, before submitting claims for MDPP services where those coaches appear as rendering providers. The billing provider or supplier or organization NPI corresponds to your organization's NPI. Organizations must obtain a separate NPI to use in association with their MDPP enrollment. This practice reduces claim rejections and denials that may occur if multiple types of Medicare enrollment are associated with a single NPI. Cohorts receiving the approved CDC curriculum may include MDPP-eligible Medicare beneficiaries mixed with non-Medicare participants, or Medicare beneficiaries who are ineligible for MDPP. However, Medicare only covers MDPP services for eligible Medicare beneficiaries. When submitting MDPP claims for mixed cohorts, ensure that your organization only submits claims for eligible Medicare beneficiaries. Submit your claims in order of date of service. That is, the claim for 5% weight loss achievement should predate the claim for 9% weight loss achievement, or claims for 5% weight loss maintenance during the core maintenance period. You may not mix non-MDPP claims and MDPP claims on the same claim form. MDPP claims should only include MDPP HCPCS G codes that are appropriate for the year of service. Your claim will be denied if filed more than 12 months after the date of service. Before submitting an MDPP claim, please ask yourself the following questions. Did I include the demo code 82 in the correct place on the claim form? Did I include the rendering NPIs of the coach or coaches who delivered each service? Are all of the MDPP coaches listed on the claim also included on the coach roster within my organization's enrollment application in PACOS? Are my claims submitted in order of date of service? Does my claim form only include claims for MDPP services and use appropriate MDPP HCPCS G codes? Are any of the dates of service listed on the claims more than a year old? Following the completion of your claim submission, your MAC will process the submitted claim and provide you or your organization's billing agent an electronic remittance advice, or ERA, or a standard paper remit, or SPR. An ERA or SPR usually includes adjudication decisions by MACs about multiple claims. The ERA or SPR reports the reason and value for each adjustment. Please use the Healthcare Payment Remittance Advice page on the CMS website for an overview of the ERA or SPR, and refer to the Medicare Claims Processing Manual, Publication 100-04, Chapters 22 and 24, for further information on remittances. The Medicare requirement is for MACs to process clean claims within 30 days of receipt. Clean claims are those for which the MAC does not need additional documentation. If your MAC sends an additional documentation request, or ADR letter, then the claim is not considered clean. For claims that require additional review due to errors or missing information, Medicare must notify the filer of the decision within 45 days. For clean claims, MACs cannot release payment prior to 13 days from receipt of an electronic claim. For example, payment on the 14th day or after, or 28 days from receipt of a paper claim. For example, payment on the 29th day or after. In cases where a submitted claim is denied or returned by your MAC, please review the associated documentation sent from the MAC detailing why the denial or rejection occurred. If your MAC specifies that your organization's claim submission was rejected and was unable to be processed, it is you or your billing agent's responsibility to correct the errors in the submission and submit a new claim. You may file an appeal with your MAC if you believe that a claim submission was denied incorrectly. Please follow your specific MAC's instructions for submitting an appeal for a denied claim. The Who or the MACs page on the CMS website provides a list of MAC web pages with further information on specific appeals processes. The first level of appeal is redetermination by your MAC. This consists of another review of the initial claim by MAC personnel not involved in the initial claim determination. You have 120 days from the date of receipt of the initial claim determination to file a redetermination request. There are two ways that a supplier can request a redetermination. 1. You may fill out the form CMS 20027, or 2. You may make a written request. You should include with your redetermination request any and all documentation that supports your argument against the previous decision. Most MACs allow electronic submission of appeals through their website. There are additional appeals levels if your redetermination request is dismissed or the initial determination is upheld. For more information on further appeal options, please consult the CMS Medicare webpage on Original Medicare Appeals. If you have further questions on how to successfully submit a claim for MDPP using the PCA software, your MAC should be your first point of contact. If you are unsure of how to get in touch with your MAC, please refer to the MAC info page on the CMS website. For general MDPP guidance on topics including but not limited to claim submission, please visit the CMS MDPP webpage. For policy-related inquiries, please reach out to the MDPP Supplier Support Center by filling out an inquiry request form at the MDPP page. This concludes the tutorial video on fee-for-service claim submission for the Medicare Diabetes Prevention Program using the free-to-access PCA software. Thank you for watching.